Hello, everyone, and welcome to today's speaker series. Thank you all for joining us today. My name is Rosa Staltieri, and I'm the Knowledge Translation Manager with CanCOVID and the speaker series host and moderator. The COVID-19 pandemic is worsening health inequities worldwide. Canada is no exception. Some population groups are disproportionately affected due to pre-existing vulnerabilities. Governments in Canada responded to the pandemic with significant new funding and policy initiatives. But how well did these initiatives address health inequities embedded in the social determinants of health? Please join in welcoming Doctors Ronald Labonté and Dr. Arne Ruckert to discuss their findings of their recent study that analyzed government policies and programs announced between March 15th and October 21st, and what this means for Canadian policies going forward. Dr. Labonté is a co-lead of the Global One Health Network and a professor and distinguished research chair at the University of Ottawa's School of Epidemiology and Public Health. Dr. Ruckert is a research coordinator of the Global One Health Network and senior researcher at the University of Ottawa's Globalization and Health Equity Unit at the School of Epidemiology and Public Health. So before we get started, there's just a few items that we note before every presentation. We ask that we ensure that your microphones are on mute during the presentation. And during the 10-minute question and answer period, we welcome you to ask your question either live by raising your hand or by asking your question in the chat box at any point during or after the presentation. And also just to note that this session will be recorded on YouTube in about 2 to 3 business days. So without further ado, I will hand over the floor to our presenter.
Hi everybody. Thank you very much, Rosa, for the introduction and also for the invitation to speak here today about what is really a very important topic, we believe, and many others as well. The recent PHAC report, the Public Health Agency of Canada, and report was actually on health equity as well. So we are not alone in our effort to address questions surrounding health equity and social determinants of health related to the pandemic. And as I get started, I want to emphasize again that this is a report that is available online on the Global One Health Network that was co-authored by Ronald Labonté and myself and 2 others, Sean Hillier and Iyad Shadid. And so we are presenting some of the findings here today from that report. And it's essentially an environmental scan of provincial and federal programs between March and October 21. We did update it to the most recent budget as well. So it's now up to date to the end of November, essentially. And it focuses really on 4 provinces in particular, because those provinces were really the most important ones in terms of the outbreak of the virus, and therefore also in terms of the response by governments that they put in place. And so the conceptual framework that we developed for the analysis is based on 2 previous frameworks. On the one hand, we consulted the social determinants of health framework from the Canadian Public Health Association, and you see the kind of SDH pathways on the left side of your screen there. On the right side, you see a framework that we developed. It's not really our framework, we adapted it. It's a framework that was initially developed by Solaris for the WHO Commission on Social Determinants of Health, and we've adapted it slightly and applied it to the coronavirus pandemic to kind of highlight the structural determinants and the intermediate determinants that are particularly relevant in the current pandemic, and how these interact with socioeconomic status, health systems, to produce health inequities across populations in Canada and globally, of course, not just in Canada. And so we then went through these different income pathways to identify through these SDH pathways, social determinants of health pathways, to identify specific programs and policies that would be relevant to these social determinants. And of course, the most important pathway, in my opinion, on our opinion, is really the income pathway. Income is in a sense a determinant of other determinants, because if you don't have income, you can't buy food, you can't rent a house, you can't do a lot of things that are really important for good health. And so when the pandemic first hit, a lot of people were concerned about the potential income impacts of the pandemic, particularly because of the shutdowns and the lockdowns of the economy. And what became clear very quickly was that this impact will be very inequitable, that some groups might not be impacted at all. In fact, if we now know that the tech workers are doing better than before the pandemic, income has actually gone up for most tech workers. There's incredible demand for tech workers now, and that of course has lifted their incomes. But on the other hand, in general, salaried employees haven't been doing very poorly either. If you think about us academics, we're pretty much insulated from this pandemic. We can work from home. We have our income coming into our bank accounts. Not that much has, I mean, of course, there's a lot of inconvenience and a lot of impacts. But in terms of the income, a lot of people are not impacted. But on the other hand, if you think about the hourly paid employees, more precariously paid employees, those have been impacted very severely. And Statistics Canada data makes that very clear. And so when the pandemic hit, there was right away an acknowledgement of the importance of addressing the loss of income, particularly given the lockdowns. And so Canada acted fairly rapidly, I would say, and put in place a number of income replacement measures. And I'm not going to run through all of these in large detail, but I want to just highlight a few of the key points. SERP is probably the one that you're all familiar with, that received the most attention in the media. It's also by far the biggest one, currently having paid out around $83 billion. So that's a really big chunk of money. At one point, it was, I think it was almost 30% of Canadians that were applying for SERP. So it's a really significant percentage of the population. And so the SERP was initially supposed to run until the summer, July 2020, then it was extended on October 23rd. And then when the second wave started to emerge, the government realized it needs to do something else. So the Canada Recovery Benefit was introduced, which essentially replaced SERP, which was supposed to run until June 2021, but it was just, I believe, renewed until September 2021. So you have direct income replacement, and SERP is essentially an unconditional income replacement that is just paid out initially without any kind of qualification criteria. Of course, there are qualification criteria, but the CRA will check up later on to what extent people were actually qualifying for it. So SERP was really important, but there were also some important employment insurance reforms, which I don't want to go into too much detail, but essentially people could qualify more easily for employment insurance, which is important because historically only around 50% of Canadians actually qualify for employment insurance in this country. So this is an important change. And Canada introduced also the Canada Recovery Sick Benefit, which is really meant to allow people to stay home when they're sick so that they don't have to go into work, which is of course an important consideration in the pandemic. And we have the Canada Recovery Caregiver Benefit as well. Now these income replacement measures had a tremendous impact on income in Canada. And this chart just came out 2 days ago, actually. It's an analysis by Statistics Canada that shows the impacts by quintile on income of Canadians during the pandemic. And what you will see is that the income of most Canadians, in fact, all Canadians, has gone up quite significantly. If you look at the blue bar, the second quarter of 2020 is really the key bar, because that's when the income replacements took place. In the first quarter, a lot of people didn't have access to income replacement yet, but in the second quarter, the income replacement was rolled out. And so the lowest income quintile did extremely well in Canada, with a rise in income by almost by 35%, and all income quintiles did really well, actually. So there has been a significant rise in income in Canada that has not only mitigated the impacts and replaced the loss of market income, but has actually added to market income significantly. Some people are saying, see that as a problem, like the Fraser Institute, for example, some of the right-wing think tanks, which are now saying we need to be very careful about, who's going to pay for this and how this might lead to inflation. But we are personally actually welcoming this trend, because we think that income inequality is a real problem in this country. And so this is a step in the right direction to actually address income inequality, which then will lead to better social determinants of health outcomes over time. Moving from income into employment, the employment pathway is important because, as you see, again, the impacts were rather inequitable. If you look at full-time employees, not as much of an impact as part-time employees. And if you go to the sectors, again, you will see that certain sectors did really well, other sectors did really poorly. And ironically, these are the sectors, or not ironically, unfortunately, these are the sectors where a lot of women are employed. And what is really unique about the current, the recession that happened in the aftermath of when the pandemic hit is really that women were mostly the ones that dropped out of the labor market and that lost their jobs. This was released yesterday by RBC, Royal Bank of Canada, which did a really great gender analysis of the impacts, employment impacts of the pandemic. And it's really stark, the extent to which this is a she session, to the extent to which women are particularly negatively impacted by the pandemic under the employment pathway. Of course, a number of support programs were put in place to address the decline in employment. On the one hand, we had direct support programs, such as the Canada Emergency Wage Subsidy. We had also temporary wage subsidies, work sharing programs, and the Canada Summer Jobs Program. Initially, some of these programs were criticized for not being set up fast enough and not being big enough. And so the government responded and adjusted some of these to make them more easily accessible and more generous. There's also support for liquidity. This is particularly important for small businesses. If you think about the $40,000 that you can get through the Canada Emergency Business Account. And of course, small businesses are the backbone of the Canadian economy, really. 80% of employment in Canada relates to small businesses. So going forward, this is really important that we support the small business community to make sure that a lot of these businesses survive the pandemic and become productive going forward after the pandemic in the recovery phase. And there are various credit payment deferral programs that help companies and individuals as well at various levels to address the decline of income and the loss of employment throughout the pandemic. And these programs, again, were really successful. If you look at the recovery in the labor market in Canada, it is very uneven, yes. And again, you see the difference between full-time and part-time. But it is quite rapid, the decline. If you look at the decline of the unemployment rate, it was quite rapid, which was of course related to the reopening of the economy and then the second wave when the employment rate started to shoot up again at the end of 2020 into January 2021. And so we've seen tremendous progress, and now we're kind of a bit in a holding pattern. But I feel comfortable that given all these programs, that the employment pathway is very well protected going forward, and that in the recovery phase, we will see a snapback to almost previous levels of employment, hopefully right away, when the second wave comes to an end. I want to move into the food security pathway. And this is an important pathway because even before the pandemic, of course, a lot of Canadians were seeing a lot of challenges in terms of having access to secure food supply. And this has interestingly gotten much better throughout the pandemic. And initially, when the pandemic hit, the federal government provided a lot of support for food banks because it was concerned that people would not have access to enough income and would be overrunning food banks. But what actually happened was with the income replacement, the demand on food banks declined significantly in Canada. And people reported that the reasons for this decline or decrease in usage was directly related to the financial support that they received from the government. So again, the CERB income transfer really had tremendous impact in terms of addressing food insecurity in Canada. And it just gets to show how important it really is to allow Canadians to have adequate income to have access to food security. I want to briefly speak about housing related measures. And again, housing was already a challenge in Canada before the pandemic. Roughly 10% of households in Canada are in core need, means they don't have access to adequate housing because they cannot afford it. 30% of Canadians are living in substandard housing units, which means that those could be infested. If you think about public housing has a big issue with mold in Canada. It could also be, dilapidated in terms of structural dilapidation and so forth. And so housing was already a challenge coming into the pandemic. And of course, governments realized that there's a real potential for a housing bubble collapse because Canada has a bit of a housing bubble problem in our opinion. And so there was a danger that the housing market would really collapse. And there was also a danger that renters would started to be kicked out of their houses in the middle of a pandemic where you want people to be off the street, to be self-isolating. And so in response to this, a lot of provincial governments have responded and have put in place, on the one hand, eviction bans, and also have put in place rent increase, have stopped rent, have put in place caps on rent increases, essentially. However, in a lot of provinces, these have already now been phased out, even though the pandemic is still in full swing, and they were not reintroduced during the second phase of the pandemic. And so we now see, we have a lot of anecdotal evidence now about evictions gaining force, and also about homelessness going up already in cities like Toronto and Montreal. And so this will be an important thing to watch going forward, what's going to happen on the eviction front and on the homelessness front, because these are, of course, really important social determinants of health. I want to speak briefly about Indigenous populations and the particularly challenges that they faced and how the government has responded to this. And I think it is important because Indigenous communities were facing particularly challenges going into the pandemic in terms of the lack of basic infrastructure, which makes it, of course, hard to observe some of the physical distancing guidelines and the public health guidelines that have been recommended by PHAC and others in Canada. And so one would therefore expect that, given this specific challenge, that on a per capita basis, Indigenous communities would receive more funding than non-Indigenous communities. However, the funding is actually a fifth less on a per capita basis that went into Indigenous communities, that went into COVID response for non-Indigenous communities. So there's a bit of a problem here. If we have particularly challenges in Indigenous communities, but we don't address these through a funding package that would actually address these adequately, then that's an issue. And this speaks also to the issue of the water boilery advisories, which recently the government announced that it's going to move away from trying to provide infrastructure so that water boiler advisories would be essentially eliminated by, I believe the initial goal was the middle of this year. And so we've now moved away from that because there's an acknowledgement that the funding is just not there to actually build the infrastructure. And I think this is just not acceptable, especially in the context of a pandemic. And so the last pathway, I believe that we covered in this presentation, there are some others in the report, but for this presentation, I want to briefly talk about race. Race is really such an important one. And what's interesting about race is that we don't collect race-based data in Canada, and we don't really have a race-based response at all to the pandemic. You will see on the left side of your screen here that, this is essentially census-based data, and it shows you that there's a concentration of coronavirus in the same neighborhoods where we have a concentration of racialized communities in Montreal. And you see the same thing in Toronto. 83% of all cases of COVID-19 in Toronto are racialized people. 87% of hospitalizations are racialized. Yet we have around 50%, 48, I believe, of racialized people as part of the population in Toronto. So there's a significant overrepresentation of racialized communities, which is of course related to social determinants of health, namely occupation, that a lot of racialized communities are essential workers and so forth. And so yet there's no real acknowledgement of this in the pandemic response. There's no targeting, for example, vaccination race-based targeting. There's no program race-based targeting and so forth. There's one Black entrepreneurship program that was mentioned as part of the COVID response measures. And it's really just a partnership to ensure that credit flows, a partnership between banks and the government, ensure that credit flows into the hands of Black entrepreneurs. So it's a very limited response in our opinion. Then let me do my final assessment therefore. So overall, we assessed the Canada's response as a solid B. So it's a good response. It covers really income and employment pathways very well. It acknowledges gender inequalities. Now we also have, the discussion about the task force on childcare, which I think is really, again, another key gender aspect to the pandemic, that when we think about the recovery, we need to think about childcare as an important element to allow women to get back to work, which has tremendous implications for social determinants of health. The support measures could have been targeted better, in our opinion. We didn't get a lot on disability. That's a pathway I didn't cover, but in the report we mentioned that there was only a single $600 payment for people with disabilities. Beyond that, nothing. No real vaccination, nothing, even though there's now efforts by people to raise this issue. indigenous communities, not enough action on a per capita basis. So there's certain pockets where we need to act better. There's also a threat of unintended consequences of some of the measures, namely housing and stock bubbles and further growth in inequality. Even though we have these income measures for the low income workers, we have at the end of the day, a lot of the interventions have actually increased the inequality because the stock market has been going up so much. And so there's potential for a rise in inequality going forward, especially if these income measures, these income transfer measures are suddenly removed, and then the market has potential to create tremendous inequality at this point in time, in my opinion. There's also the question of inflation. We personally believe a little bit more inflation than we had in the past is good. So like 5% is a good target in our opinion, but of course we don't want to overshoot that. And ultimately the key question in our opinion is really the question of revenue generation. How are we going to pay for all of these measures? Because we believe these measures are important. They're absolutely crucial to improving the trajectory of social determinants of health in Canada going forward during the recovery phase of the pandemic. But of course, we're going to have to pay for them. And if we have to pay for them, we have to make sure that we also pay equitably for them, so that those that have the most means to afford to pay for them will have to pay the most. So we need some kind of wealth tax. We need some kind of significant income tax reform, not the one that Trudeau implemented, which was like a 1% cut on the top income earners from like 36 to 37%. Okay, fine, but it's not really the kind of change we need. We need to move back towards a tax system that has like an 80% marginal top tax income rates, like we had for most of the time of modern capitalism. We had around 80% marginal income tax rate until Trudeau the first actually came to power. And so we need significant tax reform to really make sure that all of this can be paid for, and that in an equitable way. And I'll leave it at that for now and open up the floor for discussion.
Thank you so much, Dr. Ruckert. And Dr. Labonté, would you like to add anything before we get into the question and answer period?
Very briefly, that what Arne kind of presented is an incredibly short summary of what is a much longer report. So I would encourage everyone to look at the report. We dealt more extensively with some of the problems in terms of where we were doing well in terms of the government response to the pandemic, but where we were not doing so well at all. I think all of us realize that this pandemic so far, it's killed unequally, it's affected individuals and households and population groups unequally. And I think a great concern is that it's going to impoverish unequally as we move forward, unless we take some fairly dramatic policy direction changes. And now we didn't kind of evaluate the full extent of how well all of these different kinds of policy measures affected health inequities in terms of studying what the outcomes were. We drew on the basis of what other secondary data could tell us, and on plausible past knowledge about how social determinants of health can affect different equity outcomes with respect to health status. So that's about all. Open to questions, comments.
Thanks so much. So I see that we don't have any hands up yet, but we do have one question that was sent to me privately from Sarah. The question is, do you think the evidence on CERB and decreased food bank usage can be used to support a basic annual income post-pandemic? And the second question is, do you know of any advocacy groups that are pursuing this?
Yes, I mean, there's definitely a lot of advocacy groups. The Canadian Universal Basic Income Network would be one of them, one of the key leaders at this point. It's a bit of a global movement in a sense. And we actually published an article a few years back in the British Journal of Public Health, Ron and I, with another student of ours, where we did a bit of a literature review on what's known about UBI going forward. And we strongly embraced the notion, but also made some cautions that, UBI itself is not going to solve all of our problems, because if you introduce an income, universal basic income, but at the same time you commodify social services and you then have to pay for that social service, you might actually not be better off at the end of the day. So UBI, we very much support the notion of universal basic income, and of course CERB is providing a lot of evidence for how it can do a lot of good. But at the same time, of course, it's also a question of what's the larger socio-structural context within which this income transfer takes place. because income is only one side of the equation, the supply side. You also have to look at the demand side in terms of how you're going to use that income, who's going to benefit from the way in which the infrastructure is set up. Is it a market-driven system where you're overpaying for what you're getting? Is it publicly provided? Because income in itself, if you commodify something and then you give somebody income, they can actually be worse off than if you didn't have the service commodified. So it's a kind of it's an interesting question, but one that has to be one has to be cautioned about.
Thanks so much. I don't see any other questions. I do see just a request to post a link for the report. We can do that also after the presentation. We can post it on Slack for everybody to get the link. So if we're waiting for some more questions, I do have one that I like to ask. And it's going back to your, you presented some data about women falling out of the labor force. Is there any data on reasons why they have? And then I do have just a follow-up question as whether this has to do with perhaps, and maybe not just for women, but in general, precarious jobs?
Yes. Ron, do you want to take it or you want me to go first?
Go ahead.
So the RBC report speaks to that. There's quite a bit of research. A lot of it, though, is, I have to admit, is so it's just subjective responses by people. So the research is somewhat limited, but a lot of women are saying, they can't do the double burden anymore. The fact that they're doing most of the healthcare, the childcare at home and the education at home. If you think about homeschooling in itself, I've done it. I have young children. It's quite something, it's quite a challenge. And I mean, my wife and I, we shared it fairly equitably, but in a lot of households, I don't think it would have been shared fairly equitably. There's some data on that. And that, of course, had tremendously challenged women's ability to participate in the labor force. And a lot of women have said, no, sorry, like I'm gonna have to leave now, and I might go back when the pandemic's over, but right now I need to focus on, these other types of things that are just as important, even more important than work. And so it just appears to be the case that it's mostly women that are dropping out to, take care of children, homeschooling, and so forth.
I just posted a link to the report, and I sort of see that another question has popped up about the housing bubble and how a UBI wouldn't really solve anything if we don't have affordable housing, if we don't have rental housing. I think that's first of all, in terms of the housing bubble. When you have kind of really low interest rates, which we have almost kind of negative interest rates, and then you have, as a result of the pandemic, you had a lot of people who are in the middle and upper middle income earning kind of categories who had a whole lot of cash. I mean, people were saving like crazy. The amount of liquidity going into the banks was just hugely enormous. And then not to mention what the private sector and corporate sector has. I mean, we're awash in all kinds of cash, which is why the notion that we can't afford some of the programs going forward just basically doesn't cut it. The only reason we can't afford it is because we've made some policy decisions that sort of said those who have all of it can keep it. Thank you very much, as opposed to looking at redistribution. But apart from that, one cannot kind of use a single social protection policy measure to deal with all of the problems. They have to be linked together. That's been one of the weaknesses of the emphasis on universal basic income. It's like, you know what? Markets have a tendency to take every last penny out of a poor person's pocket. And so even if you increase the number of pennies that are there, there's a way in which market systems can actually sort of take that penny out, which is why public provision of services, kind of like a public commons, kind of regenerating and strengthening what we hold in common together, is important. So transportation is free, housing is subsidized, health is free, education is free. We begin to sort of reduce all of those costs to and they're publicly provided, tax funded and publicly provided, because markets won't take those away.
Great, thank you so much both. Dr. Ruckert, would you like to add anything to that question?
Yeah, no, I think Ron covered it pretty well. It's really about the interconnectedness of all the social determinants of health, and therefore the measures have to be interconnected, right? We acknowledge that we need to start from a social ontology where the various determinants connect to each other and are intersecting, and therefore focusing a policy solution on just one single issue like income, universal basic income, is not going to address the problems across all the different sectors and the way in which the public infrastructure is set up and works.
Thank you so much, both. So it is 4:30, so I'm going to end the session. Just want to say on behalf of the CanCOVID team and network, we'd like to thank you both for taking your time to present to us on a very important topic and also facilitating such great discussion here today for us. Thank you so much. And there's a few announcements before we end the session. Please join us for our next speaker series, which is next Tuesday, March 16th at the same time, 4 o'clock Eastern time, with Dr. Colleen Norris from the University of Alberta on the impact of sex and gender on COVID-19. And also just to announce, you can also join us for a CanCOVID Partner Specials, a special event this March 11th, which is on Thursday, from 10:30 a.m. to noon Eastern time, for a factually speaking seminar where we will have experts from the CanCOVID network who will give presentations on long COVID and on the emerging science around expediting effective treatments for COVID-19. So thank you so much, everyone, for joining today, and hope to see you at our events. Bye for now.